Yes, hey everybody. My name is Esther Lucero. I'm Dene on my mom's side, Latina on my dad's side, and I am third generation of my family to live in an urban environment. It's really nice to see you again, Chairman Simpson, Ranking Member Pingree. My goodness, Congresswoman Betty McCollum, it's just really nice to see you. I haven't seen you for a couple of years, so wonderful to see you. Same with you, Congressman Kilmer. And I would like to welcome you, Congressman Edwards, to this committee. I love that you're on labor HHS. That's going to be significant, and I'll tell you why in just a moment. Nice to see you, Mr. Elsey. First I just want to start off, let's get out the appropriations out of the way. We are aligned with our 29 federally recognized tribes in the state of Washington, where they have swiftly and aggressively advocated to get the Indian Health Service to full funding. What that means for the urban Indian line item is we're advocating to get to $977.4 million. So that's very, very important that we move in that direction, and I'll tell you why. Last year, I came here and I spoke to the committee and I shared all of the incredible successes that we have had at the Seattle Indian Health Board. I was grateful for things like the funds that came through ARPA, infrastructure dollars, those types of things. And I expressed to you all what we have done with that money. I also was grateful for the fact that we'd secured a 2-year pilot for 100% FMAP funds. And I shared with you that we purchased a building where we're opening a 92-bed residential treatment program, right, to address the opioid crisis, which we're planning to open February 2025. And we talked about traditional Indian medicine last year a lot, and how we've actually developed a model where you can bill for it within our system. We've developed a mechanism to make that happen, where we have coding and everything you need to be successful. So why am I frustrated today? Because Chairman Simpson, you said we're not going to take steps backwards. I'm grateful that we didn't have cuts last year, and I'm disappointed to hear that we're not moving forward with 100% FMAP. And I'm going to tell you why that's important. Because we just learned from CMS that urban Indians are not going to be eligible, like tribes, to bill for traditional Indian medicine services. And they say it's because we don't have access to 100% FMAP. So here we are, moving out of a 2-year pilot where the Seattle Indian Health Board has been a leader in developing systems, and now we are not going to be eligible to receive that reimbursement. That is frustrating, because when we had 100% FMAP, we were able to build a residential treatment program to address a crisis that you all are talking about constantly, to address a crisis that is connected to our border issues, to address a crisis that's connected to missing and murdered Indigenous women and gender-based violence. We will increase the capacity for the state of Washington to address these issues by 64% with the opening of this residential program. And here I am today, going back to where we were 30 years ago. Secure 100% FMAP for urban Indian programs. Then you won't have to depend so much on Medicaid. Congresswoman McCollum, you mentioned earlier about Medicaid supplementing IHS. We either get to full funding or we make this billing revenue more accessible to us. Because I will tell you, I will do my part. We have been your greatest return on investment, right? We have businessmen at this table. And you know what that means. You invest a little bit of money and I gave you significant return. You asked us to improve our workforce development. Guess what? We went from one program to 29 different programs. We've graduated our first MSW practicum students who are now fully licensed. Every single one of our mental health providers is Native. We are making an impact. So what I'm saying is, you asked me to do something and I deliver. And I need you to not lose this momentum. Right? We secured advanced appropriations for 1 year. I'm hoping that we're moving to mandatory spending. Why can't we continue advanced appropriations? It worked for us. You're hearing from tribal partners the same exact thing, right? We start talking about suicidal ideation and suicide. The key to that is strengthening cultural identities. We've proven that. Our first data pool, for folks who access traditional Indian medicine in our services, there's a 28% reduction in suicidal ideation. 21% reduction in alcohol consumption, 5% reduction in depression. If you want to see changes in those outcomes and save our next generations, continue the investment. We will do our part. Yeah. I think that's what I have to say. Thank you for having me today.